Right, well, good morning, and I'll provide the COVID-19 update for Victoria first and then head into some further discussion about the transport network after that. And I can advise that today we have 36 active cases in Victoria, 4 new cases. One of those cases is in hotel quarantine, and the remaining 3 are locally acquired cases, all linked back to that Black Rock cluster, the known cluster around the cafe in Black Rock. A total of 3,962,283 tests have been received to date. That is an increase of 32,468 since yesterday. And again, we really want to thank everyone for getting tested yesterday. That figure of 32,400 is a very, very strong figure for any day, let alone it being on a Sunday over a holiday period. So we'd like to thank Victorians for their efforts in getting tested yesterday. We know that people did experience delays over the course of yesterday, but we also saw by the afternoon wait times did significantly reduce. And today, whilst we know that it will be another very busy day at our testing sites, with the extra capacity that's been added today over and above the extra capacity that was added yesterday, the extended hours, the additional sites, we are expecting the sites to be able to accommodate the demand that we expect over the course of today. Also too, there is the capacity, as there was yesterday, and that will extend into today, to redirect people from busy sites to less busy locations around the state, and encourage once again people to check out the website before they head out to check what's going on at their nearest testing venue. But it's also important to point out that there is a priority placed on those close contacts of our known cases. They will be given priority through our testing program, and those arrangements are put in place with those close contacts. Also too, our latest data with that huge volume and extra increase in testing numbers that we've experienced yesterday, we're seeing very strong turnaround times for the pathology results. We're working closely with our pathology labs, and we're seeing 86% of results received within the first 24 hours of the test being taken. So very strong results, and that with all the work that's being done with the staff who've returned from leave, huge volumes of staff that worked over the weekend, they're working today and over the course of this week, the pathologists, the test takers, the nurses, the clinical staff, the traffic management teams, they're all working really hard to support Victoria's efforts in getting tested. And then we'd also like to acknowledge there's plenty of building owners and managers who've opened up their premises to assist with this extra testing effort. This is a whole of Victorian community effort. We're seeing the Victorian community respond really strongly, and we're really proud and pleased with these results today. Also, there's a further update on arrangements for agriculture and primary producer workforce who are moving between New South Wales and Victoria. Obviously, with the border being closed, we want to make sure that these important workers, alongside other essential workers, can have that movement between the two states. And that is why, effective immediately, the arrangements under the National Agricultural Workers Code have been put in place for agricultural workers to move between New South Wales and Victoria. It means that the important work that goes to makes a big economic contribution to our state and our country can continue, but there are some very strict standards associated with the movement of ag workers between Victoria and New South Wales. It's consistent with the arrangements that have been in place now for a little while for the freight industry, and that includes workers entering into Victoria from New South Wales. They're required to wear masks at all times. When they're not working, to self-isolate, to only leave their accommodation for food or in the case of an emergency. So there are some really strong standards around this, but it's also important to ensure we have the movement of our agricultural workforce, particularly as there's a lot of product that needs to continue to move around, and a lot of workforce that's needed to support that. So that comes into effect immediately, and I believe the Agriculture Minister has put out a release to that effect today as well. Turning now to the reason why we're here at Southern Cross Station. We're here in the heart of Victoria's public transport network. As we do at this time every year, we provide information to the Victorian community about how the work that's going on across our $80 billion Big Build program, improving transport infrastructure right across the state. We provide information on how the work associated with the summer blitz will impact on people's movements around the state, and we felt it was particularly important given that many Victorians are they'll be holidaying in Victoria, they'll be moving around Victoria, and we're encouraging people to check out the Big Build website to plan their journey, because there are going to be a range of disruptions associated with our program, and one of the biggest of which is that we're closing the Craigieburn line from the 7th to the 16th of January, and that also means a closure for the Seymour and Shepparton line, whilst we get in and start works on removing the Glenroy level crossing. Glenroy level crossing is one of our most dangerous, one of our most congested. 19,000 vehicles pass this level crossing each and every day, and we're getting in there and removing this level crossing with a rail trench. 500 people will be working on this project, and this is a big project for Glenroy. There's also some associated civic development around the precinct of Glenroy, and so these works will be kicking off with that disruption to the train network later this week. And we've removed 44 level crossings later this year. We'll be also starting work on the Preston level crossing removals, which includes Bell Street, which when the Bell Street level crossing's removed, Bell Street will become level crossing free. And given that's a big and busy arterial road for Melbourne, that will not just benefit motorists in the northern suburbs, it's going to have a benefit for people right across the state. And just finally, as I said, there's work going on projects right across our city and state. There's big works continuing on the Westgate Tunnel project, particularly associated with widening the freeway and also needing to demolish the Grieve Parade overpass so that we can get in there and do the works associated with the ramps there. So that will see traffic changes in and around the Westgate Tunnel project. There's works on the Shepparton line, works on the Ballarat line, works on the Mordialloc Freeway, works in and around the CBD of Melbourne, also on our tram network. So this is a busy time. Summer, we've always grabbed the summer holiday period to get in there and undertake the work, the blitz on our transport infrastructure program, and we felt it was very important, particularly this year, with more Victorians travelling around Victoria, to give them this advice so they can check out the information, plan their journey, and factor in any additional travel time. Happy to take any questions. And you might have to shout a bit, sorry. Well, that decision on borders and indeed all other restrictions like the wearing of masks and the limits on numbers of people in family homes, that will be guided by the public health advice and will be based on the numbers. And yes, the numbers here for Victoria today, it's a very strong set of numbers. Of course, we always love the 0 days, but this is a really strong day for Victoria because it comes off the back of a huge amount of tests collected, not just yesterday, but indeed for the 2 previous days before that. A huge amount of tests have been collected, extensive interviews with the close contacts to identify a range of sites that has been made available, the information of which has been made available so people can monitor their own symptoms and if they've been near any of those sites. And then also too, the fact that these new cases are all linked back to the existing cluster, the known cluster. We now have 24 active cases associated with the known cluster at Black Rock. The rest of our active cases here in Victoria are all linked to hotel quarantine. So that's a very strong positive result for Victoria. We still have a way to go because we do want to reach for those 0 days. And to get to those 0 days, it will rely on continuing to get people to get tested, continuing the hard work of our tracing team on the interviews and publicising the information that comes from that. And then for the rest of us, for all of us, it's wearing masks, it's practising COVID-safe behaviour as we strive to get back to those 0 days. And in terms of reflecting on New South Wales, it is a positive day of figures coming out of New South Wales. I think they've indicated that they've got some, continue to have some concerns and are monitoring very closely that outbreak associated with the BWS. That they'll work closely with our public health team in Victoria as information comes to light. But it's a positive day, but we've still got a little way to go, and we'll work very hard to get back to those 0 days. Yeah, and again, that will be based on the advice from the public health team. It'll be based on where the cases that have just proceeded. At the moment, we still remain within the one existing cluster, which I think Victorians can take great comfort from, that all of our cases outside of hotel quarantine, the 24 active cases, are all linked back to that known cluster. That's something I think Victorians can take comfort from. But in terms of when will the border change and when will the restrictions change, that is absolutely all based on the public health advice, based on the circumstances on the ground here in Victoria. Also, testing is a really important input into that. The volume of tests taken every day is that helps guide the number of cases and guide the data, will help inform the public health advice. And then also too, seeing what happens in New South Wales and other states, but obviously primarily the situation in New South Wales is most prominent right now. What's happening in New South Wales does influence the decisions that are taken here in Victoria, and we'll continue to monitor that very closely. Well, the clear plan is to get back to those 0 days as quickly as possible and hold it there. And to do that, well, again, that also is not just dependent on the cases here in Victoria. It does depend on what's happening in other states, and that will also rely on Victorians continuing to get tested, continuing to follow the rules. We've already seen, and I think it's great credit to Victorians, how we've already seen Victorians very quickly pop the masks back on as they're moving around. Obviously they're required indoors, but also a lot of Victorians are wearing their masks as much as possible, and I think that demonstrates we all understand we have an individual role to play in getting back to those 0 days. We want it to happen as quickly as possible, but we do just have to wait for the tests to come in, monitor closely the case numbers and the situation that's occurring in New South Wales. Well, look, I think as we heard Alan Chen say yesterday, there is, I think, a reason to be optimistic, but we do have to be cautious in our optimism. The numbers the last couple of days have been strong for Victoria in that they also come off the back of very high testing numbers. So high testing numbers, low case numbers is providing us with this situation that we can be optimistic, but as we've learned from the past, this is a dangerous and difficult virus. It can move very, very quickly around our community. We've seen the strength of the virus, I suppose, coming out of the Black Rock cluster, where we have 24 active cases associated with that cluster. So we have to continue to be cautious, but I think we can have a cause of optimism and take comfort from the numbers in the last couple of days.
There are dozens of exposure sites, but they're around the state. They're predominantly based in like the Far East and also those bayside suburbs. Are you comfortable with the testing rates in those particular locations close to those exposure sites?
Yeah, we have testing sites. We have over 200 testing sites in operation today, right across Victoria, and there has been some extra effort put in extending the testing sites in those areas where in the southeastern suburbs, and extending the testing availability, for example, around the Doveton Community Church. But I also know from my own community in Bendigo that the Bendigo Clinic is extending their hours. Bendigo Health is extending the hours in Bendigo, so people in regional Victoria, in areas like Bendigo, can get access to testing. So yes, we have got some additional resources going into the areas where the exposure sites are located, but we also have our effort both being maintained and built on right across the state. So Victorians right across the state can have access to one of those 200 plus testing sites to go and get tested.
Are you comfortable with the number of people who are being tested in and around those exposure sites?
Yes, well, we saw yesterday the best part of 32,500 tests taken yesterday does demonstrate that Victorians have responded to the call to get tested. We, as I indicated, are prioritising primary close contacts to get tested. So yes, we do monitor. We do monitor the location of where the tests are taken and the numbers at in each local government area very carefully to make sure that we are seeing a good spread of testing right across the state, whilst pushing in harder in those areas where we know we have extra exposure.
The list of exposure sites there is growing. Is there any plan to ramp up testing around that area?
Yeah, well, again, as I've indicated, across all of our sites, we are seeing where we can to extend the hours of existing testing locations and adding extra sites. And I might get Jerome to come back to you on this afternoon around the specifics of Lakes Entrance. I do know from the experience we've had in place now for some time that we have our regional public health teams who take on this task of providing testing and extra testing where possible for their local communities. And I'll get Jerome to come back on that this afternoon. So the DHHS team, whether they're working on the testing program, the tracing program, working with whether it's a business owner of the exposure sites, they are working very, very hard around the clock so that we can provide the best possible information to the Victorian community. And that information is being drawn from the extensive interviews that are happening around the clock with the primary close contacts, and that is harvesting us a huge amount of information that is being put on the website as soon as possible. It's important to note, though, that information is made available following the conclusion of those interviews, and the information's been able to be verified. That obviously doesn't stop people if they've identified themselves as a close contact, ringing their employer and saying, "Hey, I'm a close contact." But DHHS is working very, very hard to make sure that every exposure site is being identified, that information is being made public, and then working with those businesses on giving them the best advice on what they need to do next in terms of the deep cleans that are needed for their operation and a safe reopening. What we do is, as soon as we possibly can, put the information on the website. There is a huge effort going on at the moment to test, to trace, to provide that information to the Victorian community. And look, I appreciate for business owners that people are wanting to do the right thing and they're wanting to get the information. And the information does need to go through a verification process within DHHS and business owners to be contacted. There's a monstrous team effort going on at the moment from the contact tracing team, our public health team, epidemiologists, the pathology teams, the nurses. Everyone's working really, really hard. And in terms of providing information about exposure sites, the priority has been placed on getting that information out as quickly as possible, because we know from past experience in 2020 and also the experience we're seeing with the Black Rock Cafe outbreak, that the best way to get on top of this virus is to get information into the hands of people so they can have a look for themselves, what their movements have been, have they got any potential exposure, and then they can monitor themselves for symptoms. It's also, I think, important to note that the task has been made perhaps a little more challenging over this Christmas holiday period, because people have moved around much more frequently than they would normally do in the normal course of events. There has been a number of holiday engagements and activities. People have been obviously been on holidays, and so that has seen a greater movement of people, which has led to a greater number of exposure sites being identified. And we think it's really important to get that information out there into the hands of Victorians so they can monitor the situation at a statewide level, but also monitor it in the context of their own movements, their own symptoms and their own responses. There is conversations with business owners happening all the time. I do think it's important to go back and remember that our tracing team, who are working around the clock, are harvesting huge amounts of information. Huge amounts of information. We've got 311 primary close contacts who are being interviewed. Huge amounts of information is being gathered from those interviews, and as that information is assessed and verified, it's being put on the website. And I do appreciate that this is happening rapidly. It's happening in real time, and DHHS and the public health team will continue to work hard with businesses. But it is through that frame of making sure we get the information in the hands of Victorians as quickly as possible.
What's happened to suburban contact tracing teams? Are they working on the Black Rock cluster?
Look, I believe so, but I'll get your own to update you on that this afternoon.
Sorry, do you know if there's suburban contact tracing
I
teams?
believe there is some of the suburban public health teams have been mobilised for the response to the Black Rock cluster. In terms of the precise nature and where they are, I'll get your own to talk to that this afternoon, because I know Eastern Health and Austin have been involved in the response on the ground.
When the outbreak started, I guess, deteriorating or escalating in the northern beaches in Sydney, that was just before the Christmas period. I guess the government was warning Victorians not to go to Sydney, or even maybe possibly stay away from New South Wales. We were entering that Christmas and New Year period where there's a lot of staff taking leave. I guess, what kind of things did the Victorian government do as they were warning Victorians not to go to New South Wales to increase their to have a surge capacity?
Well, it is important to note that, yes, we were giving very clear advice as far back as the 18th to the 20th of December about Victorians travelling to New South Wales, particularly to the northern beaches and the greater Sydney area. And that was at a time when Victoria's cases were, I think we got to 61 days of zero cases. And so our response here in Victoria was proportionate to the situation here in Victoria, being very mindful that the first three cases were identified on the 31st of the 30th and the 31st of December, and as soon as there was the identification of those local cases, work was done to put in place the additional resources needed to have the testing response. And the reason why I'm going through that period of time is because we wanted to make sure that over that Christmas period, where Victoria had experienced 50, 60 days of zero cases, that our hard-working health workers who had worked so hard protecting our community over the course of 2020 had the opportunity to have a break. And that was very important in terms of the health and wellbeing of our health working staff, that they were given the opportunity to have a break over that Christmas season. And then when the three cases were identified over that 30th and 31st period, 1st of December period, and the need to ramp up testing, and in addition to that, the closing of the border, we've seen over the last 2 or 3 days so many of those hardworking health work staff come back to work. They've given up their holidays, they've given up their precious time with families to come back and undertake this testing program, and that's in direct response to the need to increase our testing capacity at a time when, yes, it had been planned that there would be a break for those staff. Unfortunately, for many of those staff, their break has been cut short, and they've come back and are doing a terrific job providing these huge number of testing opportunities. 32,500 tests taken yesterday, 22,500 the day before are huge numbers on a normal period. To think that that's been stood up in a holiday period after a period where there was 61 days of no cases, that's a very quick mobilisation of resources to get the testing numbers in. The low case numbers that have come out of that testing, those testing numbers, give us great comfort about how Victorians are responding to this latest outbreak.
But throughout 2020, we've realised that, COVID doesn't care about state borders, doesn't care about holidays, doesn't care about, 60 days of zero cases. When the Victorian government first started realising that there was a growing outbreak in Sydney, how was it planning to, immediately surge its capacity, not wait for an outbreak to actually occur?
Well, I think I've just identified to you how we did that. No, I think we've just identified
about how you were planning to increase the capacity before we even had cases.
as I've just identified, we had arrangements in place where we could mobilise very quickly the capacity to have 18,500 tests done on New Year's Day, the reported on New Year's Day, 22,500 on the Saturday, 32,500 yesterday. On a more normal period of time, that they are very strong numbers. They're big numbers, and I think that demonstrates that there were arrangements in place that should we need to gear up and gear up quickly, we could do that. And I do think it's important to note that in order to be able to do that, we've relied on people who have worked so damn hard during 2020 to keep our community safe. Our health workers and other associated testing staff who didn't get any sort of a break in 2020 deserve the opportunity to have a break when we had no cases for 61 days. And then when the call to arms was put out and the request to come out and get tested, they have responded very strongly so that we've got this huge volume of tests, out of which we've got very low case numbers that can give us great comfort about the situation here in Victoria. Sorry, I can't hear you all at once.
Who made the decision to house the tennis players at the Western Hotel?
Well, the decision around any hotel that's associated with the Australian Open has been made by COVID Quarantine Victoria in consultation with Tennis Australia, and it's all been based on and ticked off by the public health advice. And so those arrangements, whether it's for the Western or any other accommodation venue that's being used with the Australian Open, goes through that same rigorous process where there are very strict and strong infection prevention and control measures put in place for each and every venue that is associated with either the Australian Open or our hotel quarantine program more broadly. Sorry, Simon, I missed the start of that. Well, look, again, that's something that I'd have to get the COVID Quarantine Victoria to come back to you on those specific arrangements. You've presented a hypothetical. Let's hope that doesn't happen. But it's a fair question to pose, and we'll get COVID Quarantine Victoria to come back to you.
Would it have been better to be in a hotel?
Sorry, I can't.
Would it have been better to be in a hotel without permanent residents, and we wouldn't have these concerns?
So if you're referring back to the case of the Western, as I indicated, the Western, like every venue, went through a rigorous assessment. Very strict infection prevention measures are put in place at all of the venues. In terms of the Western, where there are some permanent residents who live there, the very clear advice is that they will arrange for being put in place so there is no contact between the existing residents and people staying associated with the Australian Open. There are separate entrances, there are separate floors, there are floor monitors on every floor, there's a 24/7 Victoria Police presence associated with every venue. And so that's those arrangements for the Western. and every other venue associated with the running of the Australian Open go through those very strict, rigorous measures that are all about keeping, obviously, people associated with the Australian Open safe, but also importantly too, the rest of the Victorian community. Look, I'd have to get COVID Quarantine Victoria to come back to you in terms of the engagement they've had with the Western. If the reference to potential legal challenge is also a bit difficult to respond to, given it's not in our hands as to whether that goes ahead or not. I mean, these arrangements have been put in place because we recognise too that the Australian Open is an important event for the Victorian community and the Victorian economy, but it's also more important to keep the Victorian community safe at a time when we're seeing other parts in the world have incredibly high case numbers. We have a situation here in Victoria that is precious by world standards. We are working very, very hard to protect that status here in Victoria, and today's case numbers and the testing regime associated with that continues to give us comfort, but we have to continue to work very hard to keep the situation here in Victoria as it is, the one that Victorians themselves has built over the course of 2020. So I spoke earlier to the commanding tester, Jerome Weimer, and was advised that we've received around 2,200 applications for consideration of Victorians coming back to Victoria who had been in New South Wales. To date, 175 of those have been processed. There are additional resources being pushed on the team that is examining each and every one of these applications. You can understand that there's the detail has to be examined about what's on the application. Each case is being case managed with individual attention. That takes a bit of time to work through, but it's also important to note that there are immediate exemptions, if you like, for people facing a medical emergency, and there's essential workers and other compassionate reasons why those processes will move more quickly for some whilst we work through those 2,200 applications. I believe they have, and the precise number as at this morning, we'll get to you with the update later today. Yes, yeah, there are very clear. I mean, this is the same legal framework, I suppose, that's been used for the decisions that have been taken over the course of 2020 around restricting people's movement. Sorry, I can't. Sorry, did you say stop Sydney-siders? Yeah. Well, it is. Well, it's the reason is the public health advice. Like let's each and every decision that we make, whether it was a decision we made in 2020 or decisions we're making in 2021, are so associated with slowing and stopping the spread of this dangerous and deadly virus, comes from the public health advice and the associated framework that goes with that. And this is of primary importance right now that we continue to pedal very, very hard. 3 cases today, 3 cases yesterday, all linked to the Black Rock cluster, give us great comfort that the arrangements we have in place, the settings we have in place here in Victoria are working. It means we have to keep at them for a bit longer and look forward to getting back to those 0 days where we can start to see some of these restrictions lifted. Well, look, I've heard those reports on ABC radio this morning. I have not received any advice about the content of those reports and therefore can't comment on your question regarding Victoria Police, but would really point to the fact that these are more matters for the federal government to respond to. I just repeat, I have no advice on the media reports today that obviously make it a little tricky to answer those questions on this matter, which is primarily a matter of national security and for the federal government to respond to. Well, look, we need to review that over the course of this week, and the public health advice again will guide that. I think the settings that the public health advises that the settings that are in place right now are working in terms of slowing and stopping the spread of the virus. Of course, that's not to say that with each test that comes in, there is the risk that there may be a new case that's not linked. But we're in a very strong position here in Victoria. We'll be having meetings over the course of this week. The advice at this stage is that those settings won't change. But of course, as all of our settings are, they're advised by the data and the health advice that goes with the data.
Can I just clarify? Workers required to wear masks and offices?
Can I come back to you because I know that changed when the settings were changed, and with the introduction of indoor masks, I would say the answer is yes, that if you're indoors you will need to wear a mask, but I'll get some advice confirming that. I'm sorry, I didn't. In which quarantine? Home quarantine. We'll get Jerome to update you on those numbers. There are many because as we know, we had 60,000 Victorians come back over the course of New Year's Eve and New Year's Day. Some arrangements for those, depending on the time they cross the border, will be different in terms of the length of time they're in home quarantine. But we'll endeavour to get a figure and come back to you. In terms of that example you've given, I'll refer you to COVID quarantine Victoria to respond.
New South Wales has just said that it's taking too many international arrivals from other states, and other states need to do their fair share of the heavy lifting. What's your response to that?
Well, I think each state will determine their own situation based on their own circumstances, and that's why here in Victoria we have reintroduced those returned international travellers, but under a very, very strict COVID quarantine set of arrangements. And for noting, that includes the mandatory testing of all international flight crew. We're the only state to undertake mandatory testing of all international flight crew, and to date 30,000 tests have been undertaken, and there's been seven cases identified out of that, and we'd actually encourage other states to pick this up because we see it's just another layer of protection, another way we can make sure we're using every effort to keep the Victorian community safe. Yep. So some of those 32,000, yes, are picked up from the 8,000 that were in the lab overnight, if you like. I'm advised that we've got another, in addition to the 32,000 tests taken yesterday, there's the best part of another 10,000 sitting in the lab overnight again. So that's again demonstrates the huge effort by Victorians to go out and get tested, and also the huge effort of our testing team and the staff to be able to gear up very quickly and have those big volumes of numbers roll in. Sorry, I can't. Yeah. In terms of the process for the returned people who are not in Victoria and are wanting to return to Victoria who've travelled in New South Wales, we are working through their circumstances on a case-by-case basis with each of those applications. We'd encourage Victorians to apply, to make an application for consideration. Priority right now is being given to people with particular medical needs, particularly emergency medical needs and other emergency requirements. They're being given a priority. As we work through those priorities, also too, I should note that for residents who live in the established border bubble, they can come in. There's no limit on them being able to return. So those processes are being moved through as quickly as we possibly can. And then for the case example that you've cited of, say, families wanting to make sure they're back for the start of school, we're having a look at that. But any decision based on anyone coming back from New South Wales will only be granted an exemption based on the health advice and their movements at the time. Well, I do know what you mean. I think in terms of the fast tracking right now, our focus is on those people who have a particular emergency need or a critical time need. For compassionate reasons is another reason as well. The other cases we will want to move to very quickly. Significant additional resources have been added to the team who are assessing the applications today. We are advising people that there will be a 24 to 48 hour turnaround period on each application, but again noting that we're giving priority to emergency reasons, compassionate reasons, essential workers. Once we get through that bulk of the applications, I think we can then move pretty quickly to the balance. Just again though, I really do want to emphasise though that the exemptions will only be granted based on the health advice. We want people to apply, we want them to be considered, but it will only be given based on the health advice.
People saying that it sounds like you have the sniffles during your pressing here. Is that true? Hay fever, what's going on?
It is. I have the delightful affliction of having some allergies, and living in regional Victoria and heading into Melbourne from time to time only exacerbates them. Thank you for your well concern, Grace. Yes. Yes. So the Premier is being briefed in real time on the situation in Victoria and indeed nationwide. I've spoken to him on multiple occasions. To be honest, that I'm not entirely sure of his diary arrangements. I know I'm looking forward to a period of leave in the back half of January, but I think it's understandable that there is a need for after 2020 for people to recharge and rejuvenate, but I also want to say that the Premier is being briefed in real time. He's keeping a very close eye on the situation here in Victoria.